Welcome to Middle Class Matters, Business News in English from Dr CMA Alagesan on CAG Audit Report number 11 of 2023 on Pradhan Mantri Jan Arogya Yojana PMJAY on various misappropriations and misdealings in this scheme. Part number 17 continued. Monitoring and Grievance Redressal, Chapter 7. 7.1 Introduction. Monitoring and evaluation help organizations to extract relevant information from past and ongoing activities that may be used as the basis for programmatic fine-tuning, reorientation, and future planning. Without effective planning, monitoring, and evaluation, it is impossible to examine if a scheme is functioning in the right direction, whether progress and success may be claimed, and how future efforts might be improved. Good planning combined with effective monitoring and evaluation plays a major role in enhancing the effectiveness of schemes. At the central level, National Health Authority (NHA) is the nodal agency set up for scheme implementation and oversight of PMJAY. It is responsible for monitoring through the following functional domains: Beneficiary Management System (BMS), Transaction Management System (TMS), Provider Management System (PMS), Support Function Management comprising functions such as capacity building, grievance management, fraud and abuse control, call centers, etc. In order to facilitate the effective implementation of the scheme, the state governments have set up State Health Authority or Agency (SHA) or entrusted this function to any existing agency or trust or society designated for this purpose. All key functions relating to delivery of services under PMJAY shall be performed by the SHA, including monitoring of the scheme at state level. Issues related to the support function management, such as capacity building, grievance management, and fraud and abuse control, are discussed in succeeding paragraphs. 7.2 Non-formation of District Implementing Units (DIUs). PMJAY capacity building guidelines stipulate constitution of district implementation units (DIUs) in each district for functional coordination of scheme activities at the district level. Audit noted that in 5 states and union territories, namely Andaman and Nicobar, Dadar and Nagar Havali, and Daman and Diu, Himachal Pradesh, Puducherry, and Uttarakhand, DIUs had not been formed by SHA. In Tripura, DIUs have only been constituted in 5 out of 8 districts. District Implementing Unit is the lowest level for implementation of this scheme. Non-formation of DIUs poses constraints in the proper implementation of PMJAY. NHA, while accepting the audit observation, replied in August 2022 that DIUs are expected to work under the leadership of CMO or district collector, and whenever DIUs have not been formally constituted, the scheme implementation has been taken care by the office of CMO. 7.3 Adequacy of staff and infrastructure in SHAs and DIUs. 7.3.1 Shortfall of human resources in SHAs and DIUs. Audit noted that in 9 states (Andhra Pradesh, Chhattisgarh, Gujarat, Haryana, Karnataka, Rajasthan, Tripura, Uttarakhand, and Uttar Pradesh) there was shortfall of human resources deployed in SHA ranging between 15% and 50% against actual sanctioned strength, while in 8 states and union territories (Andaman Nicobar, Assam, Bihar, Dadar and Jammu and Kashmir, Madhya Pradesh, Manipur, and Punjab, the shortfall was between 51% to 75%. In Ladakh, while at the SHA level, the state program officer, state program manager, and state accountant were working at district level program coordinators, information systems manager, and district grievance manager were still not appointed. In Puducherry, out of 18 posts across various categories in the SHA, only 2 posts of medical officer and finance manager had been filled, while the remaining 16 posts were vacant. In Nagaland, 8 posts of various managers have not been filled in SHA, while only one officer was designated as district nodal officer against 5 officers or staffs at district level. In Jammu and Kashmir and Maharashtra, no district program coordinator, district medical officer, district information systems manager, and district grievance manager was appointed in any of DIUs, while Kerala has appointed only district project coordinator in all 14 districts entrusted with the duties of DIUs. NHA, while accepting the audit observation, replied in August 2022 that states were constantly urged to strengthen their human and technical resources. In addition to this, NHA has empaneled 4 agencies which can be used by the state for hiring of human resources. 7.4 Grievances redressal. To ensure that disputes and grievances of beneficiaries, healthcare providers, and other stakeholders are resolved in an efficient, transparent, and time-bound manner, NHA has developed grievance redressal guidelines and has established a central grievance redressal management system, CGRMS. CGRMS is a system for registering, processing, managing, and monitoring the redressal all grievances under PMJAY. Grievance redressal guidelines stipulate a 3-tier institutional structure to ensure timely redressal of grievances, that is, National Grievance Redressal Committee NDRC at the national level, State Grievance Redressal Committee SGRC at state level, and District Grievance Redressal Committee DGRC in each district. 7.4.1 Formation of State Grievance Redressal Committee SGRC and District Grievance Redressal Committee DGRC. PMJAY Grievance Redressal Guidelines stipulate that SGRC is to be constituted by SHA within 15 days of signing of MOU with the NHA. The District Grievance Redressal Committee DGRC is to be constituted by the SHA in each district as per the following schedule. For insurance mode, within 15 days of the SHA signing of MOU with the insurance company. For assurance mode, within 15 days of SHA signing of MOU with NHA. A. Constitution and functioning of SGRC. SGRC performs all functions related to handling and resolution of all grievances received either directly or escalated through the DGRC. Audit noted that in 3 states and union territories, Karnataka, Chandigarh and Chhattisgarh, Jharkhand, SGRCs were constituted with a delay of 1 year, 7 months and 67 days respectively. In Punjab, representation of members from the departments of Rural Development, Women and Child Development, Labour and Tribal Welfare as required under the grievance redressal guidelines have not been made. In Rajasthan, records related to the formation and functioning of the SGRC were not produced to audit. In Puducherry, SGRC has not been formed with requisite manpower for analyzing the grievances of stakeholders under this scheme. B. Constitution and functioning of DGRC. DGRC performs all functions related to handling and resolution of grievances within the respective districts. Audit noted that in Chhattisgarh, DGRC have not been constituted in 6 out of 27 districts. In Jharkhand, DGRC has been constituted with delays of 67 days. In Ladakh, DGRCs were not constituted. In Madhya Pradesh, DGRCs were not constituted in any of the districts. All complaints regarding grievances of beneficiaries were scrutinized and finalized by SGRC itself. In Manipur, DGRCs had not been constituted in 11 out of 16 districts. In Punjab, though DGRCs had been constituted, however, the Chief Executive Officer or District Development Officer or Additional Deputy Commissioner or Additional District Magistrate Development in charge of Zilla Panchayat was not nominated in the DGRC as required under grievance redressal guidelines. In Rajasthan, the records regarding constitution of DGRC was not produced to audit. Audit notes that the non-formation of SGRC and DGRC at SHA and DIU level as highlighted above may result in ineffective grievance redressal. NHA, while accepting the audit observation, replied in August 2022 that with the advancement in the implementation of the scheme, the states and union territories had started the process of constitution of DGRCs and SGRCs. 7.4.2 Shortfall in conducting meetings of DGRC and SGRC. As per para 6 of the grievance redressal guidelines, the DGRC and SGRC meeting should be conducted every month on a specific day. States may decide a particular date depending on the convenience and availability of the members of the committee. A. Meeting of SGRC in 5 states and union territories of Andaman and Nicobar, Bihar, Chhattisgarh, Gujarat, Jammu and Kashmir. No meeting of SGRC was held. In Punjab, only 3 meetings of SGRC were held against the required 19 meetings. In Jharkhand, only 3 meetings of SGRC were held against 27 meetings due during the period covered under the audit. Failure to hold meetings and less than the prescribed number of meetings of SGRC can adversely affect monitoring of the redressal. B. Meeting of DGRC. Audit noted that in 6 states and union territories, Andaman Nicobar, Chhattisgarh, Jammu and Kashmir, Jharkhand, Rajasthan and Tamil Nadu, no meeting of DGRC was held in Gujarat, Punjab and Uttar Pradesh. Shortfalls in meetings of DGRC were 53 to 100%. NHA, while accepting the audit observation, replied in August 2022 that SGRC and DGRC meetings could not be held during 2020 and 2021 due to COVID pandemic. Also during the pandemic, the members of DGRC and SGRC diverted for containing, controlling and treating COVID. SHJs should ensure the regular meetings of DGRCs be held so that the scheme can be properly monitored and shortcomings it may, if any, may be rectified timely. 7.5 Grievance Redressal Management, Fraud Prevention and Deduction Control. DGRC monitors the grievance database to ensure that all grievances are resolved within 30 days or earlier. Further, there would be State Grievance Nodal Officer SGNO nominated by SHA to address the grievances at state level and District Grievance Nodal Officer NGNO nominated by SGRC to resolve the grievances at district level under PMJAY. 7.5.1 Redressal of grievances or appeals at NHA level. 1. Delayed disposal of grievances. As per para 12.3 of the Grievance Redressal Guidelines, NHA shall provide overall supervision and monitoring of the implementation of CGRMS across all states. This may include site visits and internal and third-party process audits. Further, at least 98% grievances are to be redressed. Audit noted that out of 37,903 grievances, only 3,018 complaints, 9.8% were redressed within turnaround time TAT of 15 days, while 33,100 complaints, 87.33% were redressed beyond TAT. 1,085 complaints were yet to be redressed. Out of the 4 complaints escalated to NGRC for redressal was not made available to audit. 2. Delayed disposal of appeals. Para 7.2.5 The Grievance Redressal Guidelines stipulate that if any party to a grievance is not satisfied with the decision of the relevant Grievance Redressal Committee, it may appeal against the decision within 30 days to the higher Grievance Redressal Committee or other authority having powers of appeal as set forth in the guidelines. Audit noted that out of 1,111 appeals received from 24 states, 518 appeals, 46.62% were resolved within the turnaround time of TAT of 30 days, and 593 appeals, 53.38%, were resolved. Beyond TAT, 234 appeals resolved between 31 to 60 days, 97 appeals resolved between 61 to 90 days, and 262 appeals resolved in more than 90 days. NHA, while accepting the audit observation, replied in August 2022 that in the initial days of scheme implementation, states were primarily focused on service delivery, and with the passing time, grievance redressal is being assigned its due priority. More effective monitoring mechanism would be put in place to ensure that grievances are redressed in defined TAT. Please like the video, subscribe to the channel. Please share to your friends and relatives as information sharing, because as taxpayers we should know what is happening for our money which is being contributed as tax. Thanks for watching.